Welcome back to Rural Health News, this segment of Rural Health Today, where we fill you in on the latest in rural health headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. First, what's most urgent? Last week, a group of lawmakers put together new legislation proposing to strengthen rural hospitals' cybersecurity infrastructure. The bipartisan Rural Hospital Cybersecurity Enhancement Act is designed to safeguard patient data by providing education and training for rural hospitals. U.S. representatives from across the aisle work together to support this bill, and their hope is to equip rural hospitals with the cybersecurity development strategies needed to implement stronger cybersecurity for rural patients across the country. On to the damage report. Over the month of July 2026, 11 hospitals in the United States announced layoffs for more than 2,000 positions, not including additional undisclosed layoffs referred to as a significant workforce reduction. The hospitals, clinics, and health systems undergoing these changes cited low reimbursement and increasing expenses as the causes for the layoff and, in several cases, unit or department closures. Every healthcare provider is unique, but we all face the same pressures from immovable payer contracts and uncontrollable supply and drug cost. This ongoing trend in healthcare layoffs across the nation has not slowed down. In fact, it has a steady growth, putting families, neighborhoods, and the economic health of many communities gravely at risk. And now for today's success story. Seniors in rural communities can often become socially isolated, leading to worse healthcare outcomes and poorer mental health. To combat this, Jane Stroman, a gerontology specialist at North Dakota State University, developed and directs a pilot program called Aging in Community. The program is essentially a neighborhood watch for seniors, connecting volunteer neighbors with retirees in their respective community. Volunteering may include assisting seniors with everyday chores, managing weekly activity groups, or even just stopping by to chat. As a result of participation in the program, Aging in Community clients report having a higher quality of life and feeling more connected to local resources. In the near future, Stroman plans to expand the program into remote North Dakotan counties along America's frontier. Stories like this one emphasize the value of socialization in a person's overall health and their well-being, and the role of rural health in providing these initiatives and these programs. Thank you to our sources for this episode: the Office of Representative Houchin, the Office of Representative Thompson, Becker's Hospital Review, Fierce Healthcare, KSN, Pratt Regional Medical Center, and CBS.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.